How do patient needs impact medical necessity approval? Imagine trying to get a service covered by your health insurance and wondering what really matters to the insurer. The key factor is patient needs. Medical necessity is about making sure that a health care service or treatment is appropriate, reasonable, and essential based on the patient's specific condition. Insurers look closely at whether the care requested aligns with the patient's diagnosis and health status before approving coverage. First, the diagnosis and condition are the foundation. If a patient has a documented medical issue, the insurer wants to see that the requested service directly relates to diagnosing, treating, or managing that condition. For example, if someone has a diagnosed knee injury, an MRI must be appropriate for that injury. Services that don't connect to the actual health problem are less likely to be approved. This focus ensures care is tailored to what the patient truly needs, rather than unnecessary or routine tests. Next, detailed clinical documentation is crucial. Healthcare providers must submit records that explain why the service is needed. This includes symptoms, test results, medical history, and the treatment plan. The documentation should clearly show how the service addresses the patient's health issues. Without this evidence, insurers might deny approval because they can't verify that the care is necessary for the patient's specific situation. The setting and provider also matter. Medical necessity considers whether the care is provided in the right environment and by qualified professionals. For example, an emergency room visit might be approved if the symptoms are severe enough to requiring urgent care. But if the same visit is for minor symptoms that could be handled in a primary care office, it might be denied. The goal is to match the level of care to the patient's needs. Insurers also check if the requested care follows accepted medical standards. Treatments should be supported by current evidence-based guidelines. If a procedure is considered standard for a certain condition, it's more likely to be approved. Conversely, experimental or investigational treatments are usually not covered unless they are part of approved clinical trials. Prior authorization is another step where patient needs are evaluated. For some services, providers must get approval beforehand, showing that the care is justified based on the patient's condition. This process helps prevent unnecessary treatments and ensures that coverage is used for genuinely needed care. Finally, for services like home health care or personal assistance, insurers look at how the patient's functional limitations impact daily life. Providers need to explain why the specific amount and type of care are necessary, often supported by assessments and medical records. This personalized approach helps ensure that the care provided truly meets the individual's needs. In summary, patient needs shape medical necessity approval by making sure that the services requested are directly linked to the patient's diagnosis, symptoms, and daily functioning. Insurers relying on thorough documentation and adherence to medical standards to determine if a service is justified. This process helps ensure that insurance coverage supports care that is genuinely necessary, avoiding unnecessary procedures, and focusing on what truly benefits the patient's health. Always remember to consult healthcare professionals for personalized advice, as each person's medical situation is unique.